Imagine this. A 68-year-old woman starts forgetting where she puts her keys. She repeats the same question 3 times in one conversation. Her family panics. Could this be the start of dementia? She goes to her doctor. Blood work comes back. It's not dementia. It's a vitamin deficiency, one that's fully treatable. Stories like this aren't rare. Every year, doctors see patients referred for memory evaluations who turn out to have a nutritional deficiency instead of or alongside a neurological condition. This doesn't mean every case of memory loss is just a vitamin problem. That would be misleading and dangerous because it could stop someone from getting the real diagnosis and treatment they need. But it does mean this. Before jumping to the most frightening conclusion, doctors often check the simplest, most fixable causes first. And one of those checks is a basic blood panel for a handful of specific vitamins and minerals. In this video, we're going to walk through which vitamin and mineral deficiencies are most commonly linked to memory and cognitive symptoms, why they cause those symptoms in the first place, how they can look similar to and different from conditions like Alzheimer's disease, what the actual diagnostic process looks like, who's most at risk, and what steps you can take if you're concerned. This is not a video telling you that your memory loss is just a vitamin issue. It's a video explaining a real, well-documented area of medicine. So you're better equipped to have an informed conversation with your doctor. Let's get into it. Memory loss is one of the most feared symptoms in medicine, and for good reason. It's often associated with dementia, a progressive and currently incurable condition that affects millions of families worldwide. But memory loss isn't a single disease. It's a symptom. And symptoms can have many different causes, ranging from normal aging to stress and sleep deprivation, to medication side effects, to thyroid problems, to depression, to vitamin deficiencies, to neurodegenerative diseases like Alzheimer's. Doctors use a concept called reversible causes of cognitive impairment, or sometimes pseudo-dementia, when a set of symptoms that look like dementia are actually caused by something else, something that can often be treated or reversed. Vitamin and mineral deficiencies are one of the most well-documented categories in this group. This matters for a few reasons. First, missing a reversible cause means a person might be told they have a progressive, incurable disease when they actually have something treatable. That's an enormous difference in how someone experiences the rest of their life. Second, even when a deficiency isn't the sole cause of someone's symptoms, it can worsen an existing condition. Someone in the early stages of Alzheimer's, for example, may have their symptoms made noticeably worse by an untreated deficiency. Correcting the deficiency won't cure the underlying disease, but it may improve day-to-day functioning. Third, deficiencies like this are often quiet. They don't always come with dramatic symptoms. Someone can have a significant deficiency for years without realizing it because the symptoms, fatigue, brain fog, mood changes, forgetfulness get chalked up to stress, aging, or just having an off year. This is exactly why comprehensive medical workups for memory complaints typically include blood tests for these nutrients, alongside brain imaging, cognitive testing, and a review of medications. It's not because doctors expect to find a deficiency in every patient. Most cases of significant memory loss are not caused by a vitamin issue, but because it's a simple, inexpensive, and highly treatable possibility to rule out early. If there's one nutrient that comes up again and again in discussions of memory and cognition, it's vitamin B12, also known as cobalamin. Vitamin B12 plays a critical role in forming red blood cells, maintaining the myelin sheath, the protective coating around nerve fibers that allows electrical signals to travel efficiently, DNA synthesis, and supporting normal brain and nervous system function. Because B12 is so deeply involved in nerve health, a deficiency can affect the nervous system in ways that overlap with neurological and psychiatric symptoms. B12 isn't produced by the human body. It has to come from diet, primarily from animal products like meat, fish, eggs, and dairy, or from fortified foods. This means several groups are at higher risk of deficiency. Older adults, since stomach acid production often decreases with age, and stomach acid is necessary to release B12 from food, so it can be absorbed. This means even people who eat plenty of B12-containing foods can become deficient simply because their bodies absorb less of it. People following vegan or strict vegetarian diets without supplementation, since B12 is found almost exclusively in animal products, people with digestive conditions such as Crohn's disease, celiac disease, or those who have had gastric bypass surgery or other procedures affecting the stomach or small intestine where B12 is absorbed. People with pernicious anemia, an autoimmune condition where the body doesn't produce enough intrinsic factor, a protein needed to absorb B12. And people taking certain long-term medications, including some diabetes medications like metformin, and long-term acid-reducing medications like proton pump inhibitors, which can interfere with B12 absorption over time. A B12 deficiency can cause forgetfulness and difficulty concentrating, confusion, slowed thinking, mood changes, including depression and irritability, and in more advanced cases, numbness or tingling in the hands and feet, difficulty walking, and balance problems. Some research has explored associations between low B12 levels and cognitive decline, and this is an active area of ongoing study. What's well established is that severe, prolonged B12 deficiency can cause neurological damage, and that some of the early cognitive symptoms can resemble the early stages of dementia, enough that clinicians are specifically taught to rule this out. Here's where accuracy matters. Most research suggests that if a B12 deficiency is caught and treated early, cognitive symptoms often improve. However, if the deficiency has been present for a long time and has caused significant nerve damage, some of that damage may not fully reverse even after treatment. This is one of the key reasons early detection matters. The earlier it's caught, the better the chances of full recovery. It's also worth being clear that having normal but lowish B12 levels isn't automatically the cause of someone's memory issues. Diagnosing a B12-related cognitive problem generally involves blood tests, sometimes including additional markers like methylmalonic acid or homocysteine, which can rise even when B12 looks borderline normal, a clinical history, and ruling out other causes. Treatment usually involves B12 supplementation, either through oral tablets, sublingual forms taken under the tongue, or injections, depending on the cause and severity of the deficiency and a doctor's recommendation. This is not something to self-treat with high-dose supplements without medical guidance, especially since the underlying cause, like an absorption problem, may need to be addressed directly. B12 isn't the only B vitamin connected to memory and brain function. Folate, also known as vitamin B9, works closely alongside B12 in the body, particularly in DNA synthesis and in regulating a compound called homocysteine. When folate levels are low, homocysteine can build up, and elevated homocysteine has been studied as a potential factor in cognitive decline and cardiovascular health, though researchers continue to investigate exactly how significant this relationship is. Folate deficiency can occur due to poor dietary intake, especially low intake of leafy greens, legumes, and fortified grains. Alcohol use disorder, since alcohol interferes with folate absorption and metabolism, certain malabsorption conditions, and some medications. Symptoms of folate deficiency can include fatigue, irritability, and difficulty concentrating, again overlapping with what people might describe as brain fog or early memory concerns. Thiamine, or vitamin B1, deficiency is particularly important to understand because, in its most severe form, it can cause a condition called Wernicke-Korsakoff syndrome, a serious neurological condition that includes confusion, memory loss, including an inability to form new memories, and coordination problems. This condition is most strongly associated with chronic heavy alcohol use, which interferes with thiamine absorption, but it can also occur in cases of severe malnutrition, prolonged vomiting, or after certain bariatric surgeries without adequate supplementation. Wernicke-Korsakoff syndrome is a medical emergency. It requires immediate treatment, typically with thiamine administered by injection, because delayed treatment can result in permanent memory impairment. This is a case where the question of whether a vitamin deficiency could be mistaken for memory loss isn't just a curiosity. It's a critical, time-sensitive diagnosis that can prevent lasting brain damage if caught quickly. Vitamin D is best known for its role in bone health, but researchers have also studied its role in brain function. Vitamin D receptors are present in areas of the brain involved in memory and cognition, which has led to a substantial body of research examining possible links between low vitamin D levels and cognitive decline. It's important to be precise here. The research on vitamin D and cognition is genuinely mixed. Some studies have found associations between low vitamin D levels and a higher risk of cognitive decline, while others have found weaker or inconsistent links. Association is not the same as causation. It's possible that other factors like reduced mobility, less time outdoors, or underlying illness explain part of the relationship, rather than low vitamin D directly causing cognitive problems. What we can say accurately is this: vitamin D deficiency is common, especially in older adults, people with limited sun exposure, people with darker skin, which reduces vitamin D synthesis from sunlight, and people in northern latitudes or who spend most of their time indoors. Vitamin D deficiency has been linked in some studies to fatigue, low mood, and reduced cognitive performance, though these symptoms are nonspecific and can have many other causes. And correcting a vitamin D deficiency is generally beneficial for overall health, particularly bone and muscle health, regardless of its exact role in cognition. This is a good example of an area where it would be misleading to claim that vitamin D deficiency causes memory loss as an established fact. The honest answer is it's an area of ongoing research with some evidence of association, and vitamin D status is one of the factors doctors may check as part of a broader workup. A few other nutritional and metabolic factors are sometimes part of this conversation. Iron deficiency anemia can cause fatigue and difficulty concentrating, since the brain needs adequate oxygen delivery, which relies on healthy red blood cell function. Thyroid function isn't a vitamin, but thyroid blood tests are almost always included in memory workups because an underactive thyroid can cause slowed thinking, forgetfulness, and depression that can closely mimic early dementia and is very treatable with medication. And omega-3 fatty acids, while not a vitamin, are sometimes discussed in the context of brain health, though the evidence for supplementation directly improving memory in people without a deficiency is limited. These aren't the focus of today's video, but they illustrate the same point. A thorough memory evaluation looks well beyond just whether this is Alzheimer's or not. It looks at the whole picture of a person's health. So how does a doctor figure out whether someone's memory symptoms are from a deficiency, a different reversible cause, or a neurodegenerative condition like Alzheimer's? The first step is clinical history. The doctor will typically ask about when symptoms started and how they've progressed, diet, alcohol use, and any digestive conditions or surgeries, current medications, family history of dementia or other conditions, and mood, sleep, and stress levels, since depression and chronic stress can also cause significant memory and concentration problems. The second step is cognitive testing. Standardized tests, such as the Mini Mental State Examination or the Montreal Cognitive Assessment, are used to assess memory, attention, language, and other cognitive functions. These don't diagnose the cause, but they help establish a baseline and track changes over time. The third step is blood work. A typical panel for someone presenting with memory concerns often includes vitamin B12 and folate levels, thyroid function tests, a complete blood count to check for anemia, a metabolic panel checking kidney and liver function, blood sugar, and electrolytes, and sometimes additional markers depending on clinical suspicion. The fourth step is ruling out other causes. Doctors will also consider medication side effects, since some medications, especially certain sedatives, sleep aids, and anticholinergic drugs, can cause memory problems, sleep disorders like sleep apnea, and mental health conditions like depression, which can cause a pattern sometimes called pseudodementia that closely resembles early dementia but improves significantly with treatment of the underlying depression. The fifth step is imaging and specialist referral if needed. If reversible causes are ruled out or if the clinical picture suggests a neurodegenerative process, brain imaging like an MRI and referral to a neurologist or memory specialist may follow for further evaluation. The key takeaway is that a deficiency is one piece of a much larger diagnostic puzzle, and it's identified through testing, not guesswork, and not through symptoms alone. While anyone can develop a nutrient deficiency, certain groups are worth highlighting. Adults over 60, due to decreased stomach acid affecting B12 absorption. People on long-term acid-reducing medications or metformin. People with restrictive diets, including vegans and vegetarians without supplementation. People with a history of alcohol use disorder. People who've had weight loss or digestive surgery, and people with autoimmune digestive conditions like celiac disease or Crohn's disease. If you fall into one of these categories and you've noticed new or worsening memory or concentration issues, it may be worth mentioning these risk factors specifically to your doctor, since they can help guide which tests are prioritized. So what can you actually do? This part is about practical, safe next steps, not self-diagnosis. Don't self-treat based on symptoms alone. Memory changes have many possible causes, and taking high doses of vitamins without knowing whether you're actually deficient can, in some cases, cause its own problems. For example, excessive vitamin D or B6 can have adverse effects at high doses. Talk to your doctor about your specific symptoms and risk factors. Mention any dietary patterns, medications, or digestive issues that might be relevant. Ask about basic blood work if you haven't had any done recently, especially if you're in one of the higher risk groups mentioned earlier. Don't panic and don't dismiss it either. New or worsening memory problems are always worth having evaluated by a professional, not because it's necessarily something serious, but because catching a reversible cause early gives you the best chance of a full recovery, and catching a more serious condition early gives you and your family more time to plan and access treatment and support. And support brain health generally through a balanced diet, regular physical activity, adequate sleep, and social engagement, all of which have reasonably strong general health evidence behind them, independent of any specific vitamin discussion. Let's bring this all together. Memory loss can have many causes, and vitamin and mineral deficiencies, particularly B12, folate, thiamine, and to a debated extent vitamin D, are among the well-documented treatable causes that doctors specifically check for. This doesn't mean every case of memory loss is caused by a vitamin deficiency. Most cases of significant progressive memory loss in older adults are related to neurodegenerative conditions like Alzheimer's disease, which are not caused by and cannot be cured by vitamins alone. What it does mean is that a proper medical evaluation for memory concerns should include screening for these reversible causes, because when they are the cause or a contributing factor, they're often treatable. And catching them early gives the best chance of improvement. If you or someone you love is experiencing memory changes, the single most important step is the same one we've been building toward this whole video. Talk to a doctor, get properly evaluated, and don't try to self-diagnose or self-treat based on internet content, including this video. Thank you for watching. If you found this helpful, consider subscribing for more evidence-based health content, and let us know in the comments if there are other topics you'd like us to break down this way. This video is for educational purposes only and does not constitute medical advice. Please consult a healthcare professional for concerns about your health.